Peptic ulcer disease is a common condition that affects the lining of the stomach or the upper part of the small intestine. Many people experience symptoms like stomach pain, bloating, or nausea, but diagnosing the exact cause requires a careful and systematic approach. In this video, we'll walk you through the step-by-step process doctors use to diagnose peptic ulcer disease, from the initial conversation to advanced testing. Understanding these steps can help you know what to expect if you or someone you know is experiencing symptoms. The diagnostic journey begins with a detailed patient history. Doctors ask about your symptoms, such as the location and timing of pain, whether it worsens with certain foods, and if you have any associated symptoms like vomiting or weight loss. They'll also inquire about your medical history, medications, and lifestyle factors, such as smoking or alcohol use. This conversation helps the doctor form an initial impression and guides the next steps in the diagnostic process. After gathering your history, the doctor performs a physical examination. They may gently press on your abdomen to check for tenderness, swelling, or any unusual masses. The physical exam helps the doctor assess the severity of your symptoms and rule out other possible causes of abdominal pain. While not always definitive for ulcers, this step is crucial for identifying signs that may require urgent attention. Doctors also evaluate risk factors that might increase your chances of developing a peptic ulcer. These include frequent use of non-steroidal anti-inflammatory drugs, NSAIDs, a history of Helicobacter pylori infection, smoking, and excessive alcohol consumption. Understanding these risks helps doctors tailor the diagnostic approach and consider the most likely causes of your symptoms. Based on your history, physical exam, and risk factors, the doctor forms an initial hypothesis about whether a peptic ulcer is likely. If your symptoms and risk profile fit, they'll proceed with targeted testing. If not, they may consider other causes of your discomfort, such as gastritis, gallstones, or even heart conditions, and adjust the diagnostic plan accordingly. If a peptic ulcer is suspected, doctors may order blood tests to check for anemia, which can result from chronic bleeding. They might also look for signs of infection or inflammation. While blood tests alone cannot confirm an ulcer, they provide valuable information about your overall health and help identify complications. Helicobacter pylori is a common bacterial cause of peptic ulcers. Doctors often test for H. pylori using blood, stool, or breath tests. The urea breath test is especially popular because it's non-invasive and highly accurate. Identifying H. pylori is important, as its presence changes the treatment plan and can help prevent future ulcers. Doctors may request a stool occult blood test to check for hidden blood in your stool, which can indicate bleeding from an ulcer. This simple test helps detect even small amounts of blood that aren't visible to the naked eye, providing another clue in the diagnostic puzzle. If your symptoms are severe, persistent, or if there are warning signs like weight loss or vomiting blood, doctors may order imaging studies. These can include abdominal X-rays or CT scans to look for complications such as perforation or obstruction. Imaging is not always necessary for every patient, but can be crucial in certain situations. The most definitive test for diagnosing peptic ulcer disease is an upper endoscopy. During this procedure, a thin, flexible tube with a camera is inserted through your mouth and into your stomach and duodenum. This allows the doctor to directly visualize any ulcers, take tissue samples if needed, and even treat bleeding areas. Endoscopy is safe and provides the most accurate diagnosis. Before an upper endoscopy, you'll be given instructions on how to prepare. This usually means fasting for several hours beforehand. The procedure is typically done under mild sedation, so you'll be comfortable and relaxed. Your doctor will explain the risks, benefits, and what to expect during and after the procedure. During the endoscopy, doctors carefully examine the lining of your stomach and duodenum for any signs of ulcers, bleeding, or abnormal tissue. They may take biopsies to test for H. pylori or rule out cancer. The ability to directly see the ulcer makes endoscopy the most reliable diagnostic tool. If an ulcer is found, doctors often take a small tissue sample, or biopsy, from the stomach lining. This sample is tested for H. pylori bacteria and to rule out malignancy. Biopsies are quick, safe, and provide essential information for guiding treatment. A rapid urease test may be performed on the biopsy sample to quickly detect H. pylori. This test changes color if the bacteria are present, providing results within hours. Rapid diagnosis helps doctors start the right treatment without delay. Sometimes, the biopsy sample is sent to a laboratory for histological examination. Pathologists look at the tissue under a microscope to check for inflammation, infection, or cancerous changes. This detailed analysis ensures that nothing is missed and helps confirm the diagnosis. If endoscopy isn't available or suitable, a barium swallow x-ray may be used. You'll drink a special liquid that coats your digestive tract, making ulcers visible on x-ray images. While less sensitive than endoscopy, this test can still reveal large ulcers or complications. Once all tests are completed, doctors carefully interpret the results. They look for evidence of ulcers, bleeding, infection, or other abnormalities. The combination of clinical findings and test results allows for a confident diagnosis and helps guide the next steps in management. Not all abdominal pain is caused by peptic ulcers. Doctors consider other possible diagnoses, such as gastritis, gallstones, pancreatitis, or even heart disease. This process, called differential diagnosis, ensures that the true cause of your symptoms is identified and treated appropriately. Once a diagnosis is made, your doctor will explain the findings to you in detail. They'll discuss the location and severity of the ulcer, whether H. pylori is present, and what this means for your treatment. Clear communication ensures you understand your condition and the steps needed for recovery. Diagnosis is just the beginning. Doctors use the information gathered to create a personalized treatment plan. This may include medications to reduce stomach acid, antibiotics for H. pylori, and recommendations to avoid certain medications or lifestyle factors that can worsen ulcers. After starting treatment, follow-up is essential. Doctors may schedule repeat tests or endoscopy to ensure the ulcer is healing and that H. pylori has been eradicated. Monitoring helps catch any complications early and ensures the best possible outcome. Doctors are always on the lookout for complications such as bleeding, perforation, or obstruction. These can be life-threatening and require urgent intervention. Recognizing warning signs early is a key part of the diagnostic and follow-up process. Educating patients about peptic ulcer disease is crucial for long-term success. Doctors explain the importance of medication adherence, dietary changes, and avoiding risk factors. Well-informed patients are more likely to recover fully and avoid recurrence. Doctors often recommend lifestyle modifications to support healing and prevent future ulcers. This includes quitting smoking, reducing alcohol intake, managing stress, and avoiding NSAIDs unless absolutely necessary. These changes can make a significant difference in your recovery. A thorough review of your current medications is important. Doctors check for drugs that can irritate the stomach lining, such as NSAIDs or certain blood thinners. They may suggest alternatives or protective medications to reduce the risk of ulcer formation. While diet alone doesn't cause or cure ulcers, certain foods can aggravate symptoms. Doctors may recommend avoiding spicy, acidic, or fatty foods and encourage a balanced, gentle diet. Staying hydrated and eating regular meals can also help manage symptoms. Stress doesn't directly cause ulcers, but it can worsen symptoms and slow healing. Doctors may suggest stress management techniques such as relaxation exercises, counseling, or mindfulness practices to support overall well-being during recovery. Following your doctor's instructions is vital for successful treatment. Skipping medications or not following dietary advice can delay healing and increase the risk of complications. Doctors emphasize the importance of sticking to the plan for the best results. Even after successful treatment, peptic ulcers can return. Doctors advise regular checkups and prompt reporting of any new symptoms. Early detection of recurrence allows for quick intervention and prevents serious complications. Some symptoms require immediate medical attention, such as severe abdominal pain, vomiting blood, or black tarry stools. Doctors educate patients about these warning signs and stress the importance of seeking emergency care if they occur. Peptic ulcers are less common in children, but when they occur, diagnosis can be more challenging. Doctors use age-appropriate tests and consider different causes, such as stress or certain medications. Parental involvement is key in managing symptoms and treatment. In older adults, peptic ulcer disease may present with subtle or atypical symptoms. Doctors pay close attention to medication use, comorbidities, and the risk of complications. Early diagnosis and careful management are especially important in this group. Distinguishing between peptic ulcer disease and gastritis can be tricky, as symptoms often overlap. Endoscopy and biopsy are the most reliable ways to tell them apart, ensuring that the right treatment is given for each condition. Advances in medical technology have made diagnosing peptic ulcer disease faster and more accurate. From high-definition endoscopes to rapid laboratory tests, these tools help doctors provide better care and improve patient outcomes. Diagnosing and managing peptic ulcer disease often involves a team of healthcare professionals, including doctors, nurses, dietitians, and pharmacists. This multidisciplinary approach ensures comprehensive care and addresses all aspects of the patient's health. Support doesn't end with diagnosis. Doctors connect patients with resources such as support groups, educational materials, and counseling services. These resources help patients cope with their diagnosis and make informed decisions about their health. Ongoing research continues to improve our understanding of peptic ulcer disease. New diagnostic methods, treatments, and prevention strategies are being developed, offering hope for even better outcomes in the future. To recap, diagnosing peptic ulcer disease involves a stepwise approach, taking a thorough history, performing a physical exam, assessing risk factors, ordering laboratory and imaging tests, and confirming the diagnosis with endoscopy and biopsy when needed. Each step is designed to ensure an accurate diagnosis and effective treatment. There are many myths about peptic ulcer disease, such as the belief that spicy foods or stress alone cause ulcers. Doctors clarify that most ulcers are due to H. pylori infection or NSAID use, and that proper diagnosis and treatment are essential for healing. Empowering patients with knowledge about their condition helps them take an active role in their care. Doctors encourage questions and provide clear explanations, fostering a partnership that leads to better health outcomes. Peptic ulcer disease affects people worldwide, but the approach to diagnosis may vary depending on available resources and healthcare systems. Doctors adapt their methods to local needs, ensuring that patients everywhere receive appropriate care. Prevention is always better than cure. Doctors advise avoiding unnecessary NSAIDs, treating H. pylori infections, and adopting healthy lifestyle habits. These strategies can reduce the risk of developing peptic ulcer disease in the first place. Family and friends play an important role in supporting patients through diagnosis and treatment. Emotional support, help with medications, and encouragement to follow medical advice can make a big difference in recovery. With proper diagnosis and treatment, most people with peptic ulcer disease recover fully and lead healthy lives. Regular follow-up and attention to lifestyle can help prevent recurrence and ensure lasting health. Diagnosing peptic ulcer disease is a step-by-step process that combines careful history taking, physical examination, targeted testing, and clear communication. By understanding each step, patients can feel more confident and engaged in their care. Remember, early diagnosis and treatment are key to a healthy recovery.